India faces a silent epidemic. Heart and lung diseases are now the leading cause of death and disability. Rapid urbanization, poor air quality, and lifestyle changes have made millions vulnerable. 1 in 4 deaths is due to cardiovascular disease. COPD is the second leading cause, driven by pollution and smoking. These numbers represent real people, families devastated by preventable illness. The crisis is everywhere. City dwellers face stress and pollution, while rural communities struggle with limited healthcare and traditional cooking fuels. This dual burden demands a healthcare response that is both advanced and accessible. Pharmacists are often the first and most accessible point of care for many Indians. They're not just medicine dispensers, they're educators and trusted advisors. Pharmacists guide patients through symptoms, offer crucial advice, and help bridge the gap between doctors and communities. Their knowledge and accessibility make them indispensable in India's fight against heart and lung disease. Pharmacies are everywhere in India, urban or rural. They're a lifeline. In cities, pharmacists juggle complex prescriptions and offer quick, expert advice to busy professionals and anxious parents alike. In villages, the pharmacist is often the only healthcare professional for miles, a trusted friend who knows each family's struggles. Urban pharmacists might remind a young professional to take blood pressure medicine daily, while rural pharmacists help a farmer manage a chronic cough and suggest cleaner stoves. These daily interactions show the pharmacist's adaptability and deep community connection. They translate medical jargon into simple, practical advice. Whether teaching a city dweller about medication adherence or showing an elderly villager how to use an inhaler, pharmacists ensure treatment is effective. They bridge the gap between prescription and understanding. Their role is vital, making sure medicines work as intended, saving lives one patient at a time. In every setting, pharmacists are the last, crucial link in the chain of care. Their presence means healthcare is never out of reach. They are the heartbeat of community health. The heart and lungs are our body's engines working together every second to keep us alive. The heart pumps blood, delivering oxygen and nutrients everywhere. The lungs draw in air, exchanging oxygen for carbon dioxide, fueling every cell. When one organ struggles, the other suffers. If lungs can't supply oxygen, the heart works harder. If the heart weakens, fluid backs up in the lungs. This partnership is why heart and lung medicines are so vital. Pharmacists explain how these medicines support our body's engines, reducing strain, opening airways, and keeping us healthy. Understanding this connection empowers patients to take their medicines seriously. Taking medicine becomes an act of self-care, not just a routine. Pharmacists turn complex biology into simple, actionable advice. They help patients protect the organs that keep them alive. Pharmacology is the science behind how medicines work. And for heart and lung patients, it's a lifeline. Blood pressure medicines like beta blockers calm the heart. ACE inhibitors relax blood vessels, making it easier for blood to flow. Asthma inhalers open airways. Relievers act fast during attacks. Preventers reduce inflammation over time. Pharmacists demystify these treatments, explaining why daily use matters, even when patients feel fine. High blood pressure is a silent killer. Medicines protect the heart and brain quietly, like a seatbelt. For chronic conditions, adherence is everything. Skipping doses can lead to dangerous spikes or attacks. Pharmacists reinforce medicines are your shield, but only if used correctly and consistently. Their clear, empathetic education turns prescriptions into powerful tools for long-term health. They help patients understand, remember, and stick to their treatment plans. This support transforms lives, empowering patients to take control of their health. Pharmacists make complex science accessible, practical, and personal. They are the key to better outcomes for heart and lung disease. Pharmacists are more than medicine dispensers. They're counselors and educators at every step. They provide a safe space for questions, breaking down treatment plans and offering reassurance. Discussing side effects is crucial. Pharmacists explain what's normal, when to seek help, and how to stay on track. They offer practical tips, using pill organizers, setting reminders, or linking medicines to daily routines. For asthma, they demonstrate inhaler techniques and suggest tools like spacers for better results. These skills are rarely taught in busy clinics but are essential for success. Consider Mrs. Devi, who feared her nebulizer. Her pharmacist patiently taught her, turning anxiety into confidence and improving her health. Pharmacists build trust through hands-on guidance and empathy. Their support keeps patients engaged and empowered. They turn confusion into clarity and fear into action. Every conversation is an opportunity to improve a life. Pharmacists are the educators who make healthcare work. Pharmacists are leaders in community health, reaching far beyond their counters. They organize health camps, offering free screenings for blood pressure, sugar, and lung function, catching diseases early. These camps reach people who might never visit a clinic, making healthcare accessible to all. Pharmacists explain results, provide advice, and connect patients to doctors when needed. They promote government programs like Jan Aushadi, making affordable medicines available and breaking myths about generics. Pharmacists also educate about clean air and healthy habits, leading talks in schools and communities. Their outreach transforms pharmacies into wellness hubs. They build a culture of prevention and awareness. By championing public health, pharmacists empower entire communities. They are the driving force behind healthier futures. Technology is transforming pharmacy practice, making care smarter and more connected. Digital records help pharmacists track prescriptions, spot drug interactions, and monitor adherence. Health apps and smart devices empower patients to manage blood pressure, asthma, and more, with pharmacists guiding their use. Smart inhalers and telemedicine bridge gaps between rural and urban care, bringing expert advice to remote areas. Pharmacists use these tools to enhance, not replace, their personal connection with patients. Technology frees up time for meaningful conversations and better counseling. Data from apps and devices fuels more personalized advice. By embracing innovation, pharmacists shape a responsive modern healthcare system. They ensure no patient is left behind no matter where they live. Technology and pharmacists together are building the future of Indian healthcare. Pharmacists are the unsung heroes of India's public health story. They're trusted advisors, educators, and the backbone of community care. Their role in fighting heart and lung disease is indispensable, from cities to villages. Years of dedicated service earn them deep community trust. This trust turns advice into action and pharmacies into health hubs. Pharmacists champion affordable medicines, prevention, and digital innovation. Empowered by knowledge and technology, they lead India toward proactive wellness. By supporting pharmacists, we strengthen our communities and build a healthier nation. Their legacy is written in every life they touch, every future they help secure.